Welcome to Mercy Community Healthcare. I'm Cindy Seiler, the CEO, and I'd like to take you on a tour of our facilities. As we enter the lobby, you can see in both the peds and the adult wings that the mission statement of Mercy is prominent on the walls. Mercy exists to reflect the love and compassion of Jesus Christ by providing excellent health care to all and support to their families. As we venture to the adult wing of Mercy, let me tell you just a little bit more about our services. We offer 4 key areas of service: primary care for adults and children, counseling and psychiatry care for all ages, chronic care management that began with pediatrics and then to adults, and patient and family support services, including care coordination services for all patients. As a federally qualified health center, an FQHC, Mercy Community Healthcare is a safety net for the areas that we serve. Anyone can walk through these doors regardless of their ability to pay and receive the excellent services that we provide. As we enter the adult area, I want to explain some of the modifications that we've had to make with the unprecedented circumstances of COVID-19. The outside entrance that was formerly used for staff only is now being used to serve as a triage and treatment area for anyone who presents at the health center or on the phone with related symptoms. As we walk through the adult wing, we have our nurses station, the workstation for our physicians and nurse practitioners, our lab, and 9 exam rooms. Our integrated mental health services include a behavioral health consultant. A bit unique to Mercy, there is a behavioral health consultant, or BHC, which is a licensed clinical social worker positioned in both the adult and the pediatric wings. The BHC is the first point of contact for a patient to access either our psychiatric services or our behavioral health counseling, and you will hear more about both later in the tour. This hallway holds both exam rooms, nurses' offices, and 2 of the 5 psychiatric providers' offices. It also has procedural rooms at the end of the hallway. These 2 rooms are utilized by providers to conduct skin tag removals, EKGs, diabetic foot care, and other procedures that can be done here at Mercy. And now to the pediatric wing. As you may know, Mercy Community Healthcare began in 1999 as Mercy Children's Clinic, and while we have expanded our services, pediatrics is still a significant part of our mission. The pediatric side is a bit larger, but mirrors the adult side. Here's the nurses station. We have a fully equipped lab where we can run in-house tests such as urinalysis, flu and strep, mono, RSV, and pregnancy tests. There are also lab tests that we send out such as CBCs, lipids, and thyroid panels. Through the years, donors have been so kind to donate specialty items such as this exam table, and because of their generosity, we've been able to serve more and more people in need. In this specialty room, we are able to do several procedures on site, such as sutures, suture removal, nebulizer treatments, and circumcisions. This larger room is also used as an exam room when we have larger families or children in wheelchairs or on a gurney. And as we enter the back hallway, I want to explain that in 2016, we remodeled the whole area, keeping patient care space as our priority. So it limited our staff space. We have a lounge that's supposed to serve 50 people, it's rather small, and only 1 restroom in this back area for this whole wing. At any given time, there are 6 providers, physicians or nurse practitioners, utilizing this space for charting, calling families, calling specialists. As you can see, we use our space as wisely as possible. The other side of this U-shaped space houses not only the pediatric exam rooms, but also administrative offices, including the IT department. As we mentioned earlier, there's a BHC embedded in both the adult and the pediatric side. This allows for a warm handoff to take place if a provider is with a patient and deems necessary for psychiatric or counseling services to be provided. Our goal is to integrate those services and to take care of the whole person, the mind, the body, and the spirit, and do so with the compassion of Jesus. Mercy's board-certified physicians and qualified nurse practitioners saw over 11,000 people last year. The 160 staff employees here at Mercy care for those folks in 52,000 visits. We are here for this community. We're here for people in need, and we're here to serve with the compassion of Jesus Christ. As we mentioned before, patient and family support services are offered in Suite 304, which is across this bridge. And now I'm going to ask Dorothy Bullard, our Business Development Officer, to lead the rest of the tour through the patient and family support services and down to the counseling center. I will see you at the end of the tour.
Hi everyone, I'm Dottie Bullard, the Chief Business Development Officer here at Mercy, and I want to tell you a little bit about our Care Coordination Department. In this department, we'll assist patients with social service needs in addition to their medical needs. Here we educate, advocate for, and empower patients to reach self-sufficiency. We also connect families with community resources in order to help them attain the highest quality of care. In this department, we have several certified application counselors where they are used to help families and the community apply for marketplace health insurance plans, as well as TennCare and Covered Kids. We also have bilingual staff who assist families with these same services. This is also another aspect of our integrated services, which we call our healthcare hub. Now I'll walk you down to Suite 202, which is our counseling center. You'll notice that the decor in our counseling center is different. People feel a sense of healing and calm as they walk in the door. The counseling center houses 15 therapists. The therapists walk hand in hand with the primary care providers and psychiatric providers to provide care for the whole person, mind, body, and spirit, to the glory of God. Each therapist helps their patients navigate life challenges in a comforting and encouraging environment. All of Mercy's therapists have a master's degree or a PhD. We provide counseling services for both pediatric and adult patients. This is our group room, which provides space for group therapies such as Lego Club, art therapy, impulse control classes, and emotional regulations work groups. As we walk around the corner, I want to share with you a little about our school counseling program. Mercy has therapists in 31 schools in Williamson County School District, Franklin Special School District, and in Marshall County School District. The therapists work directly with the students and work with the teachers and administrators to help their students thrive. This is our PCIT Room, which stands for Parent-Child Interaction Therapy. It's one of only a few in Williamson County and the only one that serves families regardless of their ability to pay. This room helps to build healthy and secure attachments between parents and children and create a positive, loving interaction, all while addressing behavioral concerns. Children and their parents interact in this room while the therapists observe and coach parents from this other room while watching through a one-way mirror.
Thank you so much for taking the tour with us today. We've actually only scratched the surface of the provision of care that we provide to people across Middle Tennessee. If you would like to know more about how to be more involved in our mission, how you or your company could support this ministry, please visit our website, www.mercytn.org, or contact Christy Sylvester at christys@mercytn.org for additional information. Please do not hesitate to contact any of us or come in for an in-person tour at any time. Thank you again for your interest in Mercy and for your concern for the people that we serve. Have a blessed day.